So when did you first learn that you had endometriosis?
I was 30 years old.
30, but you had problems well before that.
Since I started having problems when I was 9 years old. By the time I was 14 years old is when it really got bad. And I was suffering for 3 to 5 days a month, every month, consistently. And I was just told that it was bad premenstrual, given Midol, and
walk it off.
Yeah, I was told to exercise more. I was a competitive athlete at the time, so it wasn't a matter of me just being lazy. I had great nutrition, and just nothing helped. The little hot pads that you use, and
what was your sport?
baton twirling. Competitive baton twirling.
Full contact? Competitive baton twirling? No.
Sometimes, when the batons got out of control, I broke my nose a couple times.
I've never heard anyone refer to baton twirling as a competitive sport, but
it is. It's very demanding.
I am a sheltered man. So before, at 30 was when you had your diagnosis.
Yeah.
You started having problems at 9.
Yeah.
What were the things they said it was? I mean, did at a certain point there had to be diseases passed around as opposed to just premenstrual?
I was told that it was all in my head. I was diagnosed with anxiety because the pain would get so bad that I had no coping mechanism, and I was diagnosed with irritable bowel syndrome when I was about 16 years old. We now know that I don't have irritable bowel syndrome, I have endometriosis. But for the most part, I was just told that it's a bad period and every woman goes through it. And when it would get really bad, I had numerous doctors and nurses, as my test results were constantly coming back absolutely normal. I was just told it was all in my head, that some women are more sensitive than others, and I had a low pain tolerance.
So how did the diagnosis come about?
When I was 30 years old, I went to a Medi Center, and I was very anemic. I had been missing weeks of work at a time because I physically could not get out of bed at all. It hurt to breathe. And the doctor that I had seen there, I had gone to a few times, and she was a nice lady, and she said, "Brandi, I think we need to look at the possibility of endometriosis." And I didn't really understand. I had never heard that word before. I didn't know what it was. And she set me up to go for a laparoscopy, which is a day surgery that's done, and they cut 3 little holes and go in and investigate. So Dr. Christopher Hoskins did that on November 1st. So I missed Halloween that year because I had to be at the hospital for 5 a.m. And he made sure that I was relaxed and that I understood everything that was going on. I had to sign paperwork giving permission if they needed to do a hysterectomy or any other removal while they were in there. I had to give them permission because they only wanted to cut me open once they got in. So I had to wait a week after the procedure before I knew anything. I didn't know if they had removed any of my organs. I didn't know really anything until a week later, and Dr. Christopher Hoskins showed me the photographs of the endometriosis. He explained to me what it was, and I'll never forget when he looked me in the eyes and he said, "Brandi, this disease is real. And your suffering is real. And when it hurts, I want you to close your eyes and imagine I showed you where it is. I want you to imagine where this disease is, and I want you to know that it's real." And for the first time in my life, I felt validated. After nearly 20 years of suffering, going from doctor to doctor, being treated like a drug seeker, like I was hysterical. I went years isolated from my own family because I was tired all the time. I was considered to always be making excuses for why I couldn't do certain things, why walking into the store might be too much, why I was always tired, why I couldn't wake up in the morning. Just everything hit me at once, 20 years of pain. When I found out it was diagnosed with endometriosis. And then I started doing research and learning about what it is, and I found that everything that I was finding on the internet, even the Mayo Clinic and all of the reliable medical sources, were giving me different descriptions of the disease than what my doctor had, so it was very confusing. We started off with birth control consistently to treat it. It was the first course, and I never had any relief from the pain. In fact, it went from going 3 or 5 days a month to almost every day that I was in pain. And when that didn't work after a year, then the doctor suggested a chemotherapy drug that was developed for end-stage prostate cancer, and told me that it was a very serious and a dangerous drug, and that although he would give me information, he wanted me to do my own research and know exactly what it was before I took that risk.
So you lived 20 years in pain without knowing what it was.
Yeah.
You described the feelings that came to you when you were told this pain is real, it's not in your head, you have a disease.
Mm-hmm.
How did your life change by knowing that you had a diagnosis?
It changed because I didn't doubt myself anymore. I had a medical authority that had validated my pain. I didn't feel shame anymore when I couldn't do things. I didn't feel like I was making excuses. And when people questioned me, I felt that I had to stand up for myself. I knew I had to stand up for myself before, but I felt like I was backed up by something.
How long has it been since the diagnosis?
2 years.
What's that last 2 years been like?
Hell is the only way to describe it. It helps to know what it is in so many respects, but the cause isn't known. There's no cure. There's not really a lot that can be done to help with my suffering right now. So pain management is something that has only been achieved in the last 3 months. And really all that does is help me to get out of bed in the morning and put pants on the good days.
So what are some of the things that you can't do, that you look to other people without this disease that they can do?
Can't get on the floor and play with my niece and nephew. I can't make commitments the way most people do and be reliable, because from day to day I don't know how I'm going to be feeling or how it's going to affect me. I have to plan every single day down to the minute, from when I'm going to brush my teeth, and budgeting my time and budgeting my energy so that I don't end up in bedridden for 3 days because I've overexerted myself. I like to run, I like being active, I like to travel, and I just don't feel like a grown adult. Half the time I can't even take care of myself.
So what are your fears?
When I was 21, my mother was diagnosed with ovarian cancer. Endometriosis, I've learned, does predispose you to a higher risk of certain cancers. So that scares me, knowing that it knows how to metastasize fertility. I have not been touched by a man for 3 years because of the pain. I'm just slowly developing a love with a man who is incredibly patient and understanding and compassionate. And I would love to be able to have a family one day. And it kills me not knowing if that's even possible. Being 32 years old and chemically induced into menopause, there's a chance that I won't be able to naturally conceive. And then knowing that if it is possible, I could have a child, but then the pain could be so debilitating afterwards that I won't be able to take care of myself, never mind a baby. So that is a burden that I really can't even for myself consider at my age. All my friends are married and with kids, and I see my niece and my nephew, and I wish so much to be able to have that for myself one day. So my biggest fear is growing old alone, I guess.
Do you want to stop? So you have a surgery coming up.
Yeah.
Tell me about it.
Oh, I'm so excited. So I started researching surgeons. Out of 52,000 gynecologists in North America, less than 100 are identified as being skilled with endometriosis, and 3 of them are in Alberta. I did my research and I found Dr. Liam Belland in Calgary, who is able to work with bowel and other complex issues that many surgeons cannot, especially in Canada. So few are accessible. So I got to go down and meet her in April 2014, so last month, and it was the happiest day of my life to go and meet with her and learn that she was going to do the surgery to excise the endometriosis for me. She has an expert, very highly skilled bowel surgeon that's going to be on hand and collaborating with experts from all over the world. So it feels amazing to have the fortune to be in such good hands. I could get up to 70% better after the surgery, and that's really exciting. A lot of people ask me if I'm scared, and I just want to go and do it. Go and get it done and get better.
So what do people need to know about this disease?
People need to know that it is very common, but it's not normal. It affects as many women as breast cancer. We're in desperate need of medical professionals to be skilled and knowledgeable on the most up-to-date treatments for endometriosis. And people need to understand the isolation that comes along with the pain that women go through. It's so much more than pain during sex and pelvic pain and exhaustion. It's a pain that goes so much deeper.
What can we do?
We can recognize I guess, when women have endometriosis or know they have endometriosis, that their struggle is it affects every aspect of their life. There needs to be awareness of its existence. People need to know that it's out there and that it affects so many women. And I need people to know that there are medical professionals in Alberta that can help them. And I need them to be able to identify them and be able to reach them.
Anything you want to leave? Anything else?
If I could just have one wish, it would be for women not to suffer anymore.